progress through the presentation. All right, so it's already recording. Okay. So hi everyone. Thank you for joining my workshop. The workshop is on Asian health disparities within the Pilipinx communities through the speech language pathology or SLP perspective. My name is Leila or Leila Regio. I received my bachelor's degree in 2019 in the field of communication disorders, but now I am pursuing my master's degree in speech language pathology at Cal State LA, where I also graduated from my bachelor's. And I am a second year. My pronouns are she, her, shia. And I love sharing those pronouns because it always ends up opening up a discussion with people who are not from the Filipinx background. All right. So the objectives from this workshop is really to learn about the SLP profession through an overview of historical and current trends within the field. I'll be talking more about it. There are some missing references that I did not get to input, but I can share about it. Then we can also talk about the implications of public health data within the profession and higher education. And lastly, to gain skills to advocate and collaborate with allied health professionals. So who am I? Recently, I started a new social media handle called The Multiculturalist. Had to put the K there because, represent. But really it's because I come from a field that I will talk more about, speech language pathology, that is predominantly a white predominant field of cisgender females. So a lot of the times I'm navigating places or leadership, for example, where I am the only person of color. And that could also be within the clinical setting. It could be within my community health outreach projects. So we're talking more about me. I am multiracial. I'm Filipina, Indian, Punjabi Indian, and then Chinese. Multilingual. I speak Tagalog. That is my home native language. I am someone who is an advocate for native language, so retaining that is very important. What else? Also speak Mandarin. I read and write, and I speak very basic proficiency now in terms of speaking, but I can understand written language better. Let's see. And then also Ilocana and Pangasinan. My family's from Pangasinan and also Quezon City. So if anyone is from those provinces or cities, represent. And let's see, what else? And just the multicultural aspect. Awesome. I see someone who says representing Ilocano. What's up? Okay. And then in the picture beside me is my friend Laurel Directo. She couldn't make this presentation, which I'm kind of bummed about, but it's okay. She was the only other Filipina I've ever met that I worked with, besides Caitlin now. But before Caitlin, who is in our session, she was the only individual that I knew who was Filipina. And again, our field is predominantly white. So we navigated spaces together, and we were advocates and leaders that really pushed barriers within the field of speech language pathology, specifically in the specialty of voice. And we'll talk more about that. But here's a picture of us at Keck Medicine of USC, where I've worked at the USC Voice Center, which is part of the Department of Otolaryngology and head and neck surgery. So I'll talk more about that. All right. So first, what I wanted to ask you all to do is to take out your phones, because we are going to do a survey. So what you will do is you're going to text the number 22333. And when you text that number, you're going to put the message Leila Marie 316. And when you get access to that, you should be able to see some questions. And the first question would be, have you heard of SLPs or speech language pathologists? And I'm actually going to share this screen, so give me one sec. All right, so if you can, go ahead and start inputting your responses here into this survey. I kind of want to get an idea of where everyone's at in terms of knowing what this field is, or even if you've experienced it, known someone who has experienced receiving services. And if you're having issues, please let us know, either voice it out or put it in our chat box. Oh, okay, Kamille, the text number, we're gonna put it is, so text the number 22333 with the message Leila Marie 316. Okay, so I'm seeing some responses here. Okay, this is interesting. Thank you, Kamille, for asking. Danielle asked, I texted the number and got a response, but how do I access the actual survey? Is there a link? There may have been a link that was sent to you. If you click on that link, it'll open on a web page and you'll be able to access it there. So I'm just going to talk about like what I already see. So I'm seeing that 57% of you increases. Okay, so it's increasing to a lot of you, more than half have heard of SLP, which honestly makes me really happy because the field of SLP is very, I would say, underrepresented in conversations across allied health. It's also one of those professions that have been confused with different names. And so sometimes there are different things that need to be demystified of what the field does, because it's really a versatile field. It's really interesting to see that I'm seeing that some of you have said that, yes, you have heard of it and you know someone who has received SLP services. And that is really great to know, because as you can see here, only maybe 20% has, and then I see that some have received it. But again, we know about it, but in terms of receiving services, it's still very underrepresented. And knowing what we provide in services is really a way to help advocate for our communities. So thank you for submitting your answers there. If you go to the next question, what do SLPs do? I love that I'm seeing, Joan, you said the only link that I got in text leads me to the main page of Pull Everywhere. Were you able to see a link that says, hold on, I'm gonna look at the text. It should say that if you text again, Leila Marie 316, it might send you the link that sends you to the actual survey. So if you try that, hopefully it works. Okay, thank you, Kamille, for letting them know that you texted yes and sent it, and then it resent you the link to the survey. So what do SLPs do? As you can see, if you respond with anything, it will return yes. Thank you, Eric. So yes, as you can see here in the speech bubble, what do SLPs do? There are just so many different things that we can talk about that we do, and I'll be glad to start talking about it. But I love that I'm seeing people say help with speech communication, therapy, improving quality of life. I see that some people put even some anatomical structures, I think. Okay. Building, developmental, yes, impediments that we help treat. Abilities, awesome. So it's really interesting to see just like the different things that people know about the field, and I'm really glad to see it. So who do SLPs work with? I'm seeing that answers have shown audiologists, that is correct. Pediatricians, yes. We work with a lot of different medical doctors with MDs. We also work with a lot of different allied health professionals. So audiologist is actually the one other profession that is within our realm of speech, language, and hearing. But I like that someone said that, or maybe a lot of you have said that SLPs work with everyone, which is true. We do work with everyone from the lifespan. So what I like to say is that SLPs work with people literally from their first breath to their last. And I also see that, yes, we work with patients and neurodiverse populations. Yes, we do. And we'll talk more about that. So next, the question was, what other names have you heard that refers to SLPs? And I'm seeing speech therapists, unsure, pathologists, teachers. Yes, we wear just a ton of different hats. So we can be working in the school setting. We can be working within hospitals. We can work within, and in the hospital, we can work in different specialty clinics and different outpatient, inpatient, different departments within the hospital. But we've had so many different names. It can go from swallow therapist, voice therapist, speech therapist, articulation therapist. Like our name constantly changes. And I'm here to tell you that our name officially and what should be fully recognized is speech language pathologist, because our field, again, encompasses so many different things. But if we don't say the full name, and if you don't help us educate others that our names are SLPs or speech language pathologists, we are potentially diminishing what the roles of SLPs do. All right, and then what populations do SLPs work with? I'm seeing people put everyone, age, adolescents. And again, like I said, we work with a versatile range of populations. So that can be from neurogenic disorders, so many different, there could be the peds with working with pediatrics within the either children's hospital, in the schools, whether it's because they have disabilities like through developmental disabilities. But yeah, we work with so many different types of populations, and it's constantly growing. We even work with the transgender population, and I'll talk more about that. So really knowing diversity within SLP is super crucial, and we'll talk more about that. So looking here, we are looking at what is your occupation, and if you're a student, what degree and major are you pursuing? I'm seeing that we have some masters in public health or already have that, who already received that degree. Research assistants, a student, a bachelor in public affairs, amazing. We have some childhood and adolescent development majors, MPH, public health, biostatisticians, yep. ComD, I know Caitlin, that's you. Librarian, I'm so glad to hear like there's a diverse group here that's attending this workshop. So thank you for being here. So I'm going to go back to the presentation now, if I can just get back to it. Let's see. Okay, so thank you for participating in that survey. That really helps us gauge on what you all know about speech language pathologists. So importantly, what do speech language pathologists do? SLPs. Well, within our scope of practice, we work to prevent, assess, habilitate, rehabilitate, and enhance functions of communication and swallowing. So I'm going to ask the group, does anyone know, does anyone want to give an idea of what communication means to SLPs? Caitlin, I'm going to call you out on this one.
Hi. So for me, I think communication for SLPs means that it's the ability to kind of communicate a message to everybody, and it's pretty much the way that you express yourself. And in order to do that, you need to communicate. And so SLPs are the ones that like you said, they help people to get to that point.
Thank you, Caitlin. So I see also in the chat that Danielle said things like speech and other kinds of vocalizations. Yes, because communication means having the ability to speak and use language. So that's why when we think of the name speech language pathologists are the fact that like we diagnose, we help with the diagnosis. But speech and language, there's so many different meanings to that within our field. So we break it down. But communication means, yes, like it does include the nonverbal communication. So that's what we call like functional communication. So functional is being able to send a message and have the person receiving it actually understand that message in a functional way that, again, allows you to participate in life activities. So for example, if someone has who is on the autism spectrum, they might have difficulties with pragmatics, and pragmatics is the ability to socialize and connect with other partners in their speaking environment or in their communication and social environments. So we help with that. And this may also transfer over to, for example, someone who is who acquired a speech and language disorder because of perhaps a stroke, which affected their language, speech and language systems within the brain. So within the neurological system, we need to be able to assess and understand the differences of those locations that will affect speech and language, because it does differ. And that's why speech language pathologist is our name. And then also swallowing. So we do help with people to swallow, because the swallowing mechanism is shared with the speaking mechanism. So again, it goes back to different systems that we take care of within this field. And we'll talk more about that in just a moment. Thank you, Caitlin, for sharing. And thank you all for leaving your comments in the chat box. So the two components of the SLP framework revolves around health conditions and contextual factors. So within health conditions, that we're talking about the body functions and structures. So here you're going to see, like, for example, you see the respiratory system, which is where the lungs are, going all the way up to the head. So SLPs are in charge, even up down to the diaphragm and stomach, to our head, so to the brain. And that's important to know, because that affects different parts of speech, swallowing, language mechanisms that affects our ability to participate in anything in life and to be able to connect with anyone within our communities. So we break it down into subsystems like the respiratory system, the phonation system, as you can see, is pointing to like where the throat is. This is where your voice box is. We call them the vocal folds that produces sound, and that's how you produce speech. So producing speech is like a whole, you have to have all four subsystems working. So it's the respiratory system, the phonatory, the resonatory system, which is usually like your nasal cavity, and all the articulators, which is your oral mechanism, so the mouth. And then also making sure that our brains help us to formulate our language and our speech, and all the systems and muscles that actually produce our speech and language. So I've inputted both of these images for you to understand that within SLP, we take care of cognition, we take care of communication on different aspects, and we break it down, but this is just for you to see what we work with. Health conditions also, like I was saying, activity and participation, it affects that. So activity refers to the execution of a task or action. So the image that I'm putting here is, for example, this person who is swallowing. So that is an activity that you do because it takes different muscles and cranial nerves and the ability for everything to work all at once to protect your system. So what we say when you're swallowing, why that can be difficult or an area that is something that we are concerned about, is because if you cannot swallow safely, that could potentially hurt your airway. And when I say hurt your airway, I'm saying that something is going into the airway, your windpipe, and that's what causes people to choke. But if someone's choking, that could potentially lead to someone's death. So that's why when we talk about SLPs and the lifespan, we talk about that we can actually potentially cause harm. But if we are competent and we use our mastered skills and continued practice towards evidence-based practice and just knowing what we need to know as SLPs, we can help prevent that. And this affects everyone. This can affect anyone from an infant to an older individual. And then then also participation. So that means the involvement in a life situation. So I put the picture here of people within a circle who are socially interacting, because to be able to participate, for example, when I'm going to talk about eating, because in the Philippine community, we love to eat and we love to share stories, and connect with whoever we're eating with and just enjoy our food. But that can affect your ability to socially interact with others, because when we eat, it is a part of social interaction. We are enjoying a meal and we want to share, for example, what we like about it, or we talk about our days. That can affect someone's participation in eating, either in with a partner or within a social setting. But then also, if, for example, someone has affected their language system and they're not able to communicate effectively, this will potentially lead them to feel isolated and not be able to connect with others. And we know that that is very detrimental in our health. And as we're seeing in COVID, with our physical distancing practices, we're seeing that, many people are potentially suffering from this, because isolation is not easy. Humans are naturally we are natural social people. So then contextual factors within our framework. So this is like the environmental factors. So that encompasses, for example, this makes up the physical, social, and attitudinal environments in which people live and conduct their lives. So as you can see here, we can see in the left picture, this is someone who might be in a wheelchair, maybe or in a electrical chair, because they might have ALS or cerebral palsy, and they might need like an AAC device, which we call augmentative or alternative and augmentative communication devices. And that, again, is a part of how we create functional communication. But that also means that someone who is on the receiving end needs to know how to communicate with them. And we need to know how to be more culturally considerate, because in AAC devices, for example, if we don't know what are culturally rich for an individual from a particular background or from multiple backgrounds, we might potentially be leaving out opportunities for them to connect with others. And then also I wanted to share here on the right image, like we have like a speaker there, and that is something that we do to manipulate the environment or help manipulate the environment to increase someone's speech and language opportunities, which is, for example, with speakers, might help them hear better, and which will help them understand. And that is, again, understanding language is a part of what we work on. So it's not just the expression, it's the receptive, it's understanding language. And then I wanted to really highlight on this, because this is something that really impacts me as a provider, as a future clinician, the personal factors, which are the internal influences on an individual's functioning and abilities. And that covers the fact that may be someone's religion, linguistic diversity, cultural diversities, gender identities, age, religion, it's everything. That actually all impacts our field, because we need to be culturally aware of how to respond when it comes to assessment and treatment. So the relationship of the SLP framework is that in the health condition component, it is expressed on a continuum of functioning. So intact functioning to completely compromised functioning. So different systems, if they're completely compromised, we need to be able to know how to provide them strategies to be able to functionally communicate or swallow. Intact is we're teaching them how to, again, like rehabilitate what is residual or what is still working for them. And then the contextual factors interact with each other and with the health conditions, and it may serve as facilitators or barriers to functioning. So we need to be able to integrate both contextual and health conditions when we are providing service. So we as SLPs, we influence contextual factors through education and advocacy efforts at the local, state, and national levels, but as well as educating our fellow allied health professionals. So in our delivery areas of SLP, we help people with fluency issues. So that can be, or fluency disorders such as cluttering, which is when someone talks so fast that like you literally can't understand a message, or someone who stutters. And that's what we've seen with President-elect Joe Biden. As someone who stutters, that is someone that I would be advocating for Also speech production. So that could be, for example, the motor planning and execution. That has to do with the neurological system. Articulation and or phonological speech production errors. Those are usually what we're known for within the schools. We help people with their speech production in that area. But we help with language. So this is like the spoken and written language. That all encompasses listening, processing, speaking, reading, writing, pragmatics, cognition. This is something that's also not fully always appreciated, but cognition is encompassing attention, memory, problem solving, executive functioning. This affects any of us within our work, within our ability to cognitively communicate. So a lot of different things. Then there's voice. And this is where I want to touch on when we talk about diversity, we can be serving populations, for example, that are the transgender community. And when we say voice for this, I would say it's an elective service. It's not a treatment that I would say, because they're not necessarily patients. They are individuals who are coming to find their authentic voice. And as SLPs, we help in that area because we are in charge again of this function. And if someone does not functionally and effectively use their systems efficiently, it may potentially lead to voice disorders, and that's what we want to prevent. Feeding and swallowing, and then auditory habilitation and rehabilitation. That's the population where they might be wearing hearing aids or cochlear implants, and it affects their ability to develop speech or language, or they lost it and now they're having trouble understand and then also express language. So here's an image of just kind of like a sneak peek of what it's like to be an SLP. The individual is me sitting down. I'm getting scoped through the nose. This is what they call endoscopic scoping. And you can see my larynx, which again is where I'm saying like the throat. What you'll see, like there's that two white like V's right here. Those are the vocal folds. And when air comes together, or when air pushes through, it creates speech. So it's the creation of the vocalization that we produce when we talk. And here's just me scoping another individual, a friend of mine, but just showing you that holding even instruments within our field, like this takes practice, and it takes, you need to be able to know what you're looking at, how it works, because what you'll see is there's so many different muscles coming together just for this one area to produce speech. So the potential etiologies of communication and swallowing disorders, they can be from neonatal problems, developmental, such as ASD, autism spectrum disorder, or specific language impairments, delayed language development. We have the aerodigestive tract dysfunctions, which is the airways or upper airway tracts. And just, for example, if someone has HPV or someone has head and neck cancer, it may affect their airway. And when I talk about the airway, again, that's sharing a place with the throat. So where the voice box is, where your vocal folds are, this little area can have such a huge, make a huge impact on someone's life. And we see that with COVID patients who are getting intubated for long periods of time. And how that's actually affecting our field is, it's something that we are looking into, but not enough data to know what are the trends, but I can suspect what I would think is going to happen in the next couple of years. Respiratory patterns and compromise, that's again, very much associated to COVID, but that's also with like someone who may have like lung cancer or COPD, traumas, neurological diseases such as Parkinson's, Alzheimer's, genetic, or again, aging. So the list of etiologies is not comprehensive here. There's so many, but this is just to give you an idea of what we potentially work with. So where do we work? We work in schools. We can work in early intervention centers, private clinics, skilled nursing facilities, hospitals, even doctors' offices. So what is the SLPT? So the SLPT that I want to share is that only 8% of the field is comprised of professionals that identify as a minority. I personally don't like to say minority. I like to say an underrepresented group. But what that actually means within the field is that 92% of the field is predominantly white and or cisgender female. And to relate back to cultural diversity within our field, that potentially impacts how we assess, how we treat, how we can be culturally responsive and considerate. And if we are not aware of diversity, equity, and inclusion, this can potentially harm those, and we lose trust within the communities. And we want to prevent that, and we want to have people know what SLP services are and allied health professions, and how we can help uplift underrepresented communities. So the field is predominantly white and are cisgender females. The field, however, is growing, but it is prioritizing diversity within underrepresented cultural ethnicities, bilinguals, and multilinguals. Especially as communication specialists, we need more diversity in that area. We also need more males, neurodiversity, gender, age, and the list can go on. We just need more diversity, especially within the areas of research, because, for example, when I think of gender affirmative voice, which has just been a recent new term that is being spread out throughout the field so that people are aware, because usually it's known as masculization or feminine voice therapy. But those words might potentially harm someone. So we want to be aware of that. And also I want to say that in research, it's been conducted by cisgender individuals who don't know the population and their needs. So again, prioritizing diversity and knowing those barriers are very important for us. Nationally, less than 10% of the field is actually diverse. So there you can see that I said that I've only met maybe 8 or more Kababayans in the field, and that's me working on a state and national level as a leader. However, our field is attempting to teach cultural and linguistic diversity, but there's not enough diversity, again, to teach this across the nation. So we need more diversity to equally represent the differences within minorities of all kinds, whether it's gender, language, culture, immigration, religion, etc. So making effective communication a human right, accessible and achievable for all, means that we should prioritize diversity, equity, and inclusion as to ensure that SLP services are given with the best practice of cultural and linguistic awareness, consideration, and quality of care. So now let's talk about health disparities. I'm running out of time, so I'm going to go through this quickly, but I know that in the field, these are within allied health professionals, we are talking about the social determinants or the social and economic factors. Marnelli says, I'm helping out with another word. Oh, sorry, excuse me. But these are social factors that we need to be aware of, because for me, for example, I'm looking into education, food, community, and social context. It's everything I'm looking at. And then, of course, we need to highlight racism and discrimination within the systemic and institutionalized racism that affects underrepresented communities. So here in this picture, we see that Asians, for example, are usually shown to have less, what they say, like less disabilities or health disparity data, but that needs to be demystified. Strongly needs to be demystified, because I've sat into way too many classes and in way too many projects where I'm hearing, no, they're usually okay. And that's not really the full truth. So that needs to be worked on. And I sat in Dr. Eric Dawes's data workshop yesterday. And again, talking about disaggregation of the data is super important, because if I am an SLP who wants to prevent, for example, seeing more people within the Philippine community coming in because of, for example, strokes or heart attacks, anything that would affect their speech and language, I want to be able to prevent that. And how we do that is knowing for example, we need to know what exactly is affecting our Philippine community. So here we see that our top 6 Asian populations within the US, we are in the top 3. These are the factors that can affect how someone, for example, has a long lifespan, a healthy lifespan, as well as accessing services or even the knowledge of services. So there are so many different factors that we need to be aware of. And within the Philippine community, we have many people who are within the health professions, but we still don't fully recognize all allied health professions. And we need to be able to come together to start reaching out to our community and letting them know how we can prevent seeing them within places that we could have prevented if they had known. Um, I wanted to say that, for example, in a quote that I read, people in certain ethnic groups, specifically in Pilipinx, are predisposed to working really hard, and they're heroes or things like that, which is like an American, Asian American stereotype, or what we also know as the model minority. And we need to, but it's more so because people need to continue to work in order to survive. And in a country that has such like weak social security, such as us, the United States, you have people who are ultimately sacrificing much needed healthcare for themselves for the opportunity to work and continue to make money for the family as well as abroad. And I make note of this because we're seeing a lot of our kababayans affected by COVID, and then not being aware that, again, with the previous data that was being taught in different areas of allied health, it potentially could have been it has been harmful. It has been harmful. I think that is what we need to say. It has been harmful, and we need to do a better job at educating as well as providing that awareness, and again, demystifying that myth, the monolith of Asians. So here we can see that in a data, well, this was an infographic that I found, but it was just showing that, for example, in the Philippine community, we experience, a lot of them are high blood pressure. We have diabetes, which we know is a high risk right now for COVID. Asthma, also a high risk for COVID. But here we see in a study that looked at these different Asian communities. And now we are helping to segregate this data that we are not the model minority, and we are not also this this group that, we're all okay, for example. What we are seeing is that we need to be able to actually separate this and know what is actually potentially harming different communities within the Asian continent. And here they found that Filipinos were next to Asian Indians, highly affected by cardiovascular diseases. Here I'm letting you know that, or I'm sharing the fact that in this data that undocumented Asians, we see them highly within our top three groups within Asian Indians, Chinese, and then Philippines. And when we talk about access to healthcare, this is one of those barriers that we need to be aware of. And how do we reach out? And that goes back to knowing how to be effective in our community health outreach. Here is something that I saw, and I just was probably like shocked because I for once saw something that really showed the differences within the Asian community, and it shows a really important way to separate these groups and to show the diversity and the needs within different groups. So how does public health data impact SLP? Well, how it really impacts us is that, again, we want to work to prevent. And if I'm seeing someone, for example, who acquired a stroke because of cardiovascular issues such as diabetes, or not diabetes, high blood pressure, which can lead to maybe ischemic strokes, that may potentially harm their cognition, their speech, their language abilities, because all of that is housed within our neurological system, our nervous system. And being part of the SLP profession tells me that with COVID, I suspect that we will be seeing people within the Philippine community coming in post COVID. There are trends that are being circulated, and to talk about those data, I can't fully confidently talk about it because, again, these are starting to become speculations. But for example, in post-intubation patients, what I know, especially if they've been intubated for a very long time, or trached, which is when they take out, when they input a prosthesis so that someone can swallow through a tube, or feed through a tube. Eric said, I missed, I would love to hear that. I would love to learn about it. But what I wanted to say is that I'm nervous, for example, of how this will impact the Philippine community, and how does the SLP with less diversity affect that potential trend that we might see later on. So for example, the fact that I am now within a national leadership board on the executive council, I am bringing awareness, and I'm bringing in awareness nationally, that within the Philippine community, again, we are not a monolith. Asians are not a monolith, but within Philippine communities, we have different ethno-linguistic communities and groups. And that means that if we have over 176 languages, and I'm a communication specialist, how does that affect assessment and treatment? And how can that potentially leave out what we could have effectively provided in our services because of the lack of diversity? So this is why public health data is very important for us to be able to, one, back up our reasonings, and be able to start reaching out to our community and knowing who are we going to start partnering with within the allied health professions. So we want to make accessible speech language pathology services accessible for all. But I especially want to focus that on the Philippine community, because we are being affected by COVID and health disparities that actually potentially needs SLP services. And a lot of the times there is an awareness for that. So how can we reclaim Pilipinx health and our identities? I will say that sharing your pronouns, one, will be great, because, for example, if I put she, her, xia, it leads to an open conversation of what is xia, and I can teach them that in our identity, we have gender neutral pronouns. But then also in terms of reclaiming our health, it's to reach out to our communities and start working together with different allied health professions to reach out to them and build trust and help them understand what we can do to prevent them from having, for example, having to need SLP services, because losing communication or the ability to swallow are essentially humanistic characteristics that are usually taken for granted. So the allied health professions that I am sharing, which we are missing plenty, but this gives you an idea of who we can potentially work with. But what I really wanted to talk about is multidisciplinary and interdisciplinary models. So within multidisciplinary models, this is when, for example, you can be in a hospital setting and there are multiple disciplines, but you are still working independently and separated. So you can be in a different house. For example, you can be in a clinic for head and neck, but you need to refer out. So that could potentially lead to miscommunication of documentations or medical backgrounds. So with an interdisciplinary model, that could be within a one house setting where, for example, we are in one building or in one level of a building, and there are multiple disciplines, but we are constantly communicating with each other and sharing our documentation and bringing awareness about each of our patients that we share by closing the loop. So as you can see, we're closing that circle and making sure that we're all connected. So this shows the difference when multidisciplinary models are working together. It can show that like people are still trying to navigate how to treat a patient or individual, for example. But within the interdisciplinary model, this shows that we are constantly in connection, and this can be transferred over not only in the clinical setting, but in community health outreach. So Caitlin and I have also been a part of a multidisciplinary model where we were providing oral health care or oral health screenings within the greater Los Angeles to the American natives and Alaskan Native Americans and Alaskan natives, as well as the Hispanic community. But it really just shows like we can transfer this type of work to within the Filipinx community or just any community that is experiencing really harsh health disparities that are affecting their quality of life. So the elements of an effective team working together, you can see here, requires trust, a clear process, having a good protocol or communication, having assigned roles, having a collective commitment, which again, that bayanihan, our culture, we are naturally like that. We love to help each other. Strong leadership, having respect for different disciplines and knowing how we can work together and how we can uplift our communities. Being able to take constructive feedback, that is very important, because in different disciplines, we might have learned different things or different approaches differently, and that might affect how we work together in a team. But being open to constructive feedback is very key. And making sure that everyone's voice is heard, having honest discussions. But these are just the elements of an effective team working together. And how I envision this is creating those health outreach projects, looking for grants that can help us reach out even further to our communities. So let's look to the future and reclaim Pilipinx health. So here we are nearing the end of our presentation, but I wanted to ask you all to share in the chat box to name a situation where you can implement, advocate, and or bring awareness of what you've gained from this workshop. As everyone works on that, I also wanted to share my social media and contact information. Mylene, thank you. You said that healthcare is multidisciplinary and not just medical. Yes, fact. This is my social media and contact information if you'd like to stay in touch, even talk about potential projects. I know that I've missed working on community health outreach, and I'm looking into that to focus more so on the Asian communities, because I wanted to help with demystifying the Asian monolith within the health professions. And then lastly, Danielle says, in the same vein, it'll be important to bring up the dialogue regarding how health is beyond just medicine. Yes, exactly. But both health and wellness, it is exactly true. That is why we work to prevent and again, assess. But yes, adding Xia to your pronouns, it opens up the conversation. It helps increase our representation within the fields of allied health. Or in any space that you're navigating, whether it's in leadership, in business, it doesn't matter where you are, but just sharing that opens that conversation. And so if anything, does anyone have any questions about this? Or does anyone have any comments or want to share anything about what they've learned that can potentially help anyone within their community or within their field?
Yeah, I had a little thing to add. Thanks so much, Leila. I have so many questions, so instead I'll just give a comment. Thank you. This was super helpful for me, very educational. I had no idea about like the details of SLP. I knew I'd heard of SLP, but I didn't know any of the details. And I was just at the dentist the other day, and I was thinking like I put in the comments, it's all these like activities of daily living, like day to day, that are so important, that are so invisible, which I think is where public health really can come in, and that's where it is. And it's hard for us to see that, where we're in a society where it's all about fixing the thing after it's broken, and the thing is us, right? So so props to you. Thanks again so much. I've learned a ton from your talk, so thank you.
Thank you, Eric. And I wanted to share a little bit about the community health outreach that I was a part of within the oral health screening or project. That one was in, Kaylin said, thank you for sharing a closer look of how public health intertwines with communication disorders. It gave me a better insight of the interdisciplinary side of SLP. Yes, thank you, Caitlin. We can talk about how I was a part of a community health outreach project that was working with public health, nursing, we had nutrition, dietitians, different allied health, human and health service professions that came together to work on how can we uplift the Native Americans, Alaskan Natives, and Hispanic, and also the Black community within the greater Los Angeles. But thank you all for attending and participating. I appreciate it. Thank you, Joan, for sharing.
I mean, yeah, I know that the next block of workshops starts in a couple of minutes. So if you need to go, go. but I'm just gonna keep asking another question. So like for you, like I think for me, it's just so interesting to see how much research is getting done within the SLP world now. So for me, it's like, what advice do you give to Pinoys who feel lonely when we start off our SLP, if they want to pursue SLP in the future?
That's a really good question. And that is something that I've been working on, bridging the gap, because again, going back to the fact that we are lacking diversity, that again also has led to the educational systemic racism that has created those barriers for individuals who are from Philippine backgrounds to access higher education for SLP or even audiology. But my advice is to find individuals or find those Facebook groups or the multicultural constituent groups to find mentors. But I'm glad to be a mentor for anyone who is interested in either pursuing SLP or audiology or even collaborating, because our field desperately needs it. And again, going back to the effects of COVID, COVID doesn't just affect our community, it's affecting us within our graduate programs, because we work with the mouth. We work with, again, you saw me scoping someone, that requires aerosol. And what we know about aerosol is that the particles that are associated with COVID may potentially harm us in the profession. So now it has created a barrier for me, for example, or for anyone to access externships within the medical realm. So we're now lacking experience within the medical side of SLP, which is, again, going back to my concerns, that may affect our community greatly. And if we're not bringing awareness and education on that, it may potentially lead to lack of knowledge of what to culturally consider when treating others from the Philippine community. But then I'll also add, Maylene, to start researching some background histories. You'll see that we are lacking research and knowledge in this area to talk about what SLP has, how it impacts the Philippine community. Because again, if we are the top 3 largest Asian population, then, and if we are, again, 8% diversity in the field, there's a lot lacking in terms of knowledge in that area. Does anyone else have any questions or comments or want to share anything? If not, I want to again say thank you so much for attending this workshop and for being interested in just learning about the SLP profession. It is it's a profession that really leads to great quality of life for individuals that may not have known what they take for granted within their own health. And so I appreciate you all for being here. Thanks, Caitlin.
All right, thank you so much, y'all, for coming. And this session is recorded.